Thank you for having me. Thank you for everyone for sticking around. I know it's lunchtime and the last day of the meeting. I'm a plastic surgeon, so I'm not actually a member of SAGES. I probably should be at some point in time. But we actually happen to have a plastic surgery meeting happening at the Renaissance across the street. And I walked over here this morning and I saw a whole bunch of cheerleaders and I said, I must be in the wrong place. I do have to leave this disclosure slide up for a couple of seconds, but basically I have no disclosures other than the editor-in-chief of the journal Reconstructive Microsurgery and textbook. But more importantly, I'm a microsurgeon. Dr. Park alluded to this before. Microsurgery is probably the worst thing you can do for your neck. And so there are a lot of people that I know, a lot of my colleagues that have had cervical neck surgery, had a lot of neck pain and back pain and stuff like that. So this is a particular area of interest of mine. We came out with this paper recently in JAMA Surgery, and it looked at the prevalence of work-related musculoskeletal disorders among surgeons and interventionalists. And we just looked at a systematic review, did a meta-analysis, and looked at what exactly we're talking about, right? So the pooled career prevalence of cervical spine disease is 17%. That's a huge number. Rotator cuff, 18%. Lumbar spine disease, how many people do you have, colleagues with lower back pain? Basically almost everybody, right? Carpal tunnel, 9%. And when we keep looking at this, right, the 12-month prevalence for pain, for neck pain is 60%. Shoulder pain, half the people, back pain, upper extremity pain, these are all high numbers. And that's within 12 months. And so if you think about that, this is an epidemic, this is a problem. Of those with a work-related musculoskeletal disorder, we found that 12% required a leave of absence, a practice restriction, or early retirement. And you look at that and you think to yourself, that's 12% of the workforce going out. Surgeons that require surgery. We know people that have had this, right? Orthopedic surgeons, when they looked at them, 27.6% had cervical radiculopathy. There's an MRI right there of a little lesion there. 10% of those, 10.7% of those required surgery. That's a lot. Ophthalmologists, 31% had bulging or herniating discs, and 7.6% of those required surgery. Right, so surgeons actually do require surgery from these things. Why are surgeons affected? Well, long hours, obviously, repetitive movements, static, awkward postures, which you guys deal with all the time with laparoscopic and robotic surgery. And then, what was just talked about before, challenges with instrument design. These are just pictures I took in the OR this week with my residents. And you can see that the picture in the middle, that's a tall resident, ergonomically completely incorrect. He has a medical student holding retractors on the wrong side of the table, and he's looking over the top and looking backwards. I mean, I don't know what he's doing. I'm looking at him, he's had a headlight on, he has loops on. I mean, which way are you going here? And the medical student's suffering too. You're talking about your first assistant, right? The medical student's holding the retractors from the other side of the table, moving the other direction. The resident next in the next picture on the right, she's 5'2". Look at the size of that instrument in her hands, right? She doesn't even wear a 6.5 glove. I think that's a 5.5 or a 5 glove. So if you think about that, if you can continue with this, you're gonna have problems. There's no question about it. You know, I think Dr. Park adequately summarized all this, but then these slides were shown before. But you know, obviously this is an acute issue. You see it in laparoscopic surgery and in your everyday life. I mean, it's to the point where you know, this group designed props for your arms that you could potentially use for laparoscopic surgery. You know, I mean, it's kind of a bizarre setup. But you know, I mean, if this is an acute problem, then you have to think about, you know, are there ways that we can ameliorate this? Robotic suturing, which you guys talk about, right? Obviously, robotic surgery is supposed to make this better. But then again, if you have poor sitting posture, then what difference does it make? I mean, you know, if you're sitting straight upright, that makes sense. If you're not, then your neck is going to be killing you after this case. And you're sitting there, how long are you sitting in front of that monitor? Hours on end, right? In this interesting study, they actually had people that took breaks and they didn't take breaks. These micro breaks that Dr. Park was talking about. And they took saliva samples and measured their cortisol level intermittently through the surgery. And so, I mean, they had something in there, they kind of dipped it, and you think about it, that cortisol level, if they took breaks, was obviously significantly less, and you can see that the stress level is significantly less if you take these intermittent breaks. And Dr. Park was starting to show some of these things. But there are other things that are happening. It's not just surgery, right? Every other part of our life is actually causing more and more problems. So if you think about it, your phone, everyone's got a smartphone, everyone's got an iPad, everyone's got a tablet. Nobody uses it standing upright at 0 degrees, right? You don't stand with your phone in front of your face. So every angle, little bit of angulation that you look down increases the amount of weight on your neck. If it's 15 degrees, that's 27 pounds. If it's 30 degrees, probably what most people are working at, it's 40 pounds. 45 degrees, right? That's almost 50 pounds. It's a 60-degree angle. How many of your kids, how many people you see walking around with their neck at a 60-degree angle looking at their phone? It's more common than you think. And if you think that what's happening in the OR isn't actually getting worse because of this, you're sadly mistaken. Microsurgery, this is just a slide just to humor me, but loops, headlight, microscope, I know you guys don't use a lot of this stuff, but there was a study that came out of Taiwan, and there was a group of 4 surgeons, and 2 of them actually had cervical disc herniation, required surgery, discectomy, corpectomy, titanium cage, the whole thing. The intervention was the other 2 surgeons wore a C-collar in the OR. I mean, that can't be right. And that doesn't make sense. I mean, you can see him with all that gear on. He's got a cervical collar in the OR. But then again, technology is hurting us, right? Look at this little kid with his iPad. His neck is greater than 60 degrees probably, right? He has a lot of flexibility. He's going to have neck pain. I mean, yeah, maybe not at that age, but at some point in time he will. And then how many times you're in bed with your phone and that happens, right? I mean, I can't even count. This is almost every night, right? So if you think about it, that can't be helping you either. And of course, there are other things, right? It's in the news, ABC News. Candy Crush Bender causes man to rupture tendon and thumb. I mean, he just went on like a 12-hour video game spree. NBA player Matt Bonner from the San Antonio Spurs blames elbow injury on his bigger iPhone 6. He couldn't play, right? This is technology hurting you. All right, so let's take a break. The best way to just demonstrate this is just show a couple of little things that you can do. And why don't we all stand up? Let's all stand up and let's do this, right? Because these are 3 little exercises you can do in the operating room. I mean, you're in a sterile field and all that stuff. So here we go. This is a standing neck retraction. Basically, you're in neutral position, your chest up is your shoulder, you're in neutral position. All I want to do is just push your head backwards a little bit in the forward position. So you're looking straight, you can almost put your fingers on your chin and push it back, and you feel a little bit of a stretch in the back of your neck, right? The front of your throat's crowding a little bit. It probably feels pretty good. You hold for a couple of seconds, release, repeat it 10 times. Now you can't use your finger up your chin, right? But once you understand what that motion is, and you're in the OR, and you're scrubbed, you could probably do this a couple of times, your neck is gonna start to feel a little bit better, right? Here's the next one, scapular retraction, right? If you're scrubbed, you can do this, right? You put your hands in front of you, stand in neutral position, pull both shoulders backwards, right? Squeeze both shoulder blades towards each other, backwards and downwards. That's starting to feel pretty good, right? You hold it for a couple of seconds, 10 seconds, repeat it 5 times. That's starting to feel pretty good. Here's the third one. Neck rotation, right? This is just turning your neck to the right and the left. I mean, how many times do you do this? Now, a lot of times when I do this, I can't turn my neck in a certain direction because it hurts so much. Actually, I had a brand new PA that was scrubbed in the OR. We were teaching her how to suture. She was really tall. She was about 5'10". And she was working with her head completely arced in the wrong direction. The next day, she had vertigo because she had so much cervical spine spasm that she passed out in the OR. So, neck rotation, right? How simple is this? You can go right to left a couple of times. This doesn't take that long to do. These are 3 very common, easy exercises you can do for your neck, your shoulders, and you'll feel better, right? It'll take you about 10 seconds. Now, how often should you do this? There are studies about this, obviously. But, all right, guys, you can sit back down. Thank you for humoring me. If you want to see more about this, Dr. Park had this paper up before. But there's a video in here, and I'm not going to play it, but you can find this video online, and it has the whole micro break. It's fascinating because this goes beyond your neck. So you got your hands, your shoulders, your pelvis, your girdle, like you can rotate and all that stuff. And so these are little micro breaks that we can take in the middle of in the OR. And so it is interesting concept to think about. Or you can do more lifestyle modifiers, right? They're starting to sell these devices that you stick to your back. And it can tell you what your posture is. It gives you feedback. It gives you a little buzz if you're like leaning forward too much. And these are guys for like office jobs and desk jobs and stuff like that where they're all slumped over and things like that. But it buzzes you and you stand upright. Well, maybe we need this in the OR, right? Maybe my kids probably need this. I mean, they're awful at this type of stuff. This is a vest. Okay, so this vest has multiple sensors in it. And it can tell if you're standing upright. And it can look at your spine curvature. And actually, there's an app on your phone. Right? So these things can actually tell you. There is technology that can help you with this if you feel like you have poor posture. And this is just talking about posture. We're not even talking about ergonomics in the OR or anything like that. We actually started trying this in the OR. One trial was putting the little sticker thing. One trial was wearing this vest underneath your scrubs, just to get a concept of like how often are you not in the right position. And you'd be shocked. We are not in the right position almost the entire case. I mean, almost the entire case. Sleep. This is probably the most important thing, actually, right? How much time do you spend in bed? You know, some people say, I don't sleep, I sleep 3 hours a day, something like that. But the reality is that even if you are sleeping 3 or 4 hours a day, you still need to sleep. And most people sleep in a poor position, right? How many times you see you wake up in the morning, you're flailed around, arms, head, all over the place. That can't be good for your ergonomics. It's okay when you're 10 years old. It's not okay when you're this age, right? Tri-core cervical pillow, right? I actually have the Therapeutical one. I don't condone one or the other. But basically, it's to hold your cervical spine in the right angle, right? So it's holding it in the right direction so then you don't wake up with neck or back pain. And you know, when I travel, I go to hotel rooms, give talks and stuff like that, I can't travel with that thing. It doesn't fit in my suitcase. So I roll up a towel, like in the bottom left-hand part of that screen. I roll up a towel, and that's how I sleep at night. Because the pillows in these hotel rooms are awful. It's pretty awful. If it gets worse, right, your neck starts to get worse, you go on Amazon, you start getting down a dark rabbit hole. Okay, so there are other devices that you can get, right? I mean, look at this one, the one on the top left. You can hang something over a door, give yourself some cervical traction. The one below that, I think she's got some sort of rubber band system on the top of a door. That actually has a video associated with it. It's the most bizarre looking thing. You're pulling back and forth, and it's like yanking on your neck up and down and all that stuff. Honestly, it looks like it probably feels pretty good. The top middle one is actually one that a lot of orthopedic surgeons prescribe. This is like a little pump pneumatic device, right? And it just basically stretches out your neck. This neck hammock thing on the bottom middle, I think that was a crowdsourced sort of project. And it looks like it's pretty comfortable. Obviously, you can get a seat collar. That seat collar, I love how it says FDA approved, right? That has a little crank on it. And the little crank actually starts cranking your neck straighter and straighter and straighter upright. I mean, and then the pump, I actually don't know if that pump works, but it looks pretty comfortable. Other things you can do, right? I have this ridiculous massage chair to the right, and I have it at home, and I sit in it every day. It doesn't get you right, but it fixes some of it, you know, I feel pretty good about it. They have these sensory deprivation tanks, the Epsom salt things, right? So they put you in a dive in this tank, they close the lid, they put some music on, and basically there's so much salt in there that you float. And when you float, it starts to like stretch out your joints, and I've done this before, it actually feels phenomenal, right? So there are things that you can do, just maintenance, like maintenance type stuff to get you going, get you by. And obviously it's an important problem. You know, the Duke Surgery program, I was talking to one of the residents, they have an ergonomics program in the residency program, and they talk about this all freely, right? And look at that picture with the loops and the neck and the angle, and so the more that you look at this and you think about it early on, from the earliest stages, right? If you start telling your interns or medical students about this, then they may be more and more in tune and aware that this is a real issue. And obviously, once you get to this point or later, you may be too far gone, but there are things that you can do for maintenance on a daily basis, right? You don't want to get to the point where you're going to need to have neck surgery. Conclusion. So poor ergonomics obviously leads to musculoskeletal disorders and pain, check. Awareness of surgical ergonomics issues is critical, obviously check, right? Micro breaks in the OR, right? The little exercises, that little thing where you move your head back for 2 seconds. If you do that a couple of times a case, your neck will feel pretty good at the end of it, right? If you have your neck all cranked over and turned around to the side, guess what? An hour of that, and you're in big trouble. Then obviously long-term maintenance is absolutely critical. This is the piece that we have to be aware of this, we have to be thinking about this all the time, and stop using your phone in that way where you're just like your neck's all cranked over. All right, thanks.